To access the medication chart, select the Medications button located under Actions for the current visit. Please be careful to select the current admission, as some patients will have multiple admissions listed here. The medication chart view has several tabs at the top. The ones we use are Meds on Admission, Scheduled, PRN, Stat, and Discharge. The background on the tabs are colour-coded to ensure it is clear which section you are working on. Meds on Admission displays with a green background, Inpatient Medications with a white background, and Discharge Medications with a yellow background. When you access the medication chart view, the default tab is the Scheduled tab. This lists medications that have a defined dosing frequency. In this example, the patient doesn't yet have any medications prescribed. To prescribe a medication, there are three options: Prescribe, Quick List, and Protocol. Firstly, we will look at quick lists. These are pre-built prescription items for commonly prescribed medications. Using this option helps guide the prescriber and saves them time. Let's select Quick List. In the Quick List search screen, the Quick List categories are listed on the left-hand side. As an example, we will prescribe atorvastatin. Select the Quick List group, Chapter 2, Cardiovascular. Now select the A button to narrow the search. You will see there are two entries for atorvastatin, a 40 mg dose and an 80 mg dose. Select the tick box against the Quick List item for atorvastatin 80 mg tablet, 80 mg at night, 10 o'clock. You can select multiple Quick List items in one go, before adding them to the chart. To demonstrate this, select the Quick List group Chapter 3 Respiratory. And now select the B button. Select the tick box for beclomethasone dipropionate 100 micrograms MDI 2 puffs twice a day. Now select the S button. Select the tick box against salbutamol 100 micrograms MDI 2 puffs PRN. With all the items selected, we can click on the Continue button. You are now taken to a Schedule and Details screen. Each of the selected medications are listed. If you need to change the date or time that the medication starts, you can do so here. We will leave the default date and times. The system will default the next scheduled dose time. If it needs to be started earlier, then amend this before proceeding. For example, if you are prescribing a twice daily dose at 9:30 AM, the system will default the next dose to be 10 PM. In this case, you may want to select the starting dose to be 9 AM. Once you have checked and confirmed the start time for the administration, click on Continue. The atorvastatin 80 mg dose has a system rule that alerts you to the need for LFT and lipids monitoring. These warnings will display with different override levels. In this case, we simply need to acknowledge the message, as we have checked and confirmed this has been completed by clicking Continue. You are now taken to the Chart Update screen. Please note, the medications have not yet been prescribed. This screen acts as your final check before confirming what is to be prescribed on the medication chart. Review each medication. If anything needs to be amended, such as a dose or frequency, select the drug name and amend the details. In this case, we will use beclomethasone as an example. Select the beclomethasone name. The prescribing template displays on screen. We will run through this in detail in another video. In this example, change the dose from 2 puffs to 1 puff. We will demonstrate this for you. Now we can click on Continue. Notice that the dose has been altered. When you have double-checked all the medication and dose details in the chart update screen, select Update. The action of clicking Update is essentially the approval and signing of prescriptions. The medications have now been prescribed on the chart. Please note that you are returned to the Schedule tab. You can see that there is a 2 in the Schedule tab. This indicates that there are 2 scheduled medications. You can see the atorvastatin and beclomethasone you prescribed with the scheduled doses. The PRN tab indicates that there is 1 PRN medication. Select the PRN tab to view it. You can see the salbutamol inhaler. There is a green dot in the dose column, which indicates that a dose can be administered now. The next way of prescribing is via the longhand prescribing method. Select the Prescribe button. In the search field, we will search for rivaroxaban. We don't need to type in the full name of the drug. With the search criteria entered, we can click on Search. We can now select the 20 mg rivaroxaban tablet on the right. You are taken to a screen with various fields to fill for the prescription. Because you selected a product with a strength, the dose is defaulted to 20 mg. Ensure you have checked this is the dose you intended. If you wanted to prescribe a dose range, you could select the dose range tick box here and enter an appropriate range. We don't want to do that for rivaroxaban, so we will leave it unselected. The route and form are defaulted to tablet and oral because of the product you selected. This can be changed, but please ensure you are selecting an appropriate route for the formulation you selected. Frequency is defaulted to scheduled, but could be changed to PRN or STAT at this point. For this medication, we will leave it as scheduled. The schedule defaults to a frequency of in the morning, but this can be changed to an alternative if necessary, by selecting from the drop-down list. Administration on defaults to every day, but can be changed to an alternative. Click on the drop-down, such as alternate days, odd days, even days, as well as selected days of the week, dates or numbered days. Click back on every day. Administer from and start time. This time defaults to the next available administration time and day. Always be vigilant and check this is the date and time you want the administration to start. If necessary, you can amend it, but in this example, the date and time are fine. Duration defaults to ongoing, but if necessary, you can specify the prescription to last for a certain number of doses, days, weeks, or months. Qualifier is a free text field where you can enter any relevant information about the prescription. It will be displayed within the prescription details on the chart and requires nurses to acknowledge the message when administering the medication. Indication. If necessary, you can record the indication for the prescribed medication. All antibiotics must have an indication recorded, and there are options available from the drop-down list. If the indication is not listed, you can free type it in this field. This is also displayed against the prescribed item on the chart. Below this is the time critical section. Here you can flag a medication as being time critical and specify the time frame for each dose will show on the administration chart. Standard medications will show as due 2 hours before and 1 hour after their due time. However, some medications, for example those for Parkinson's, need to be given in a smaller window. Time critical can also be used to indicate a medication is critical and should not be omitted. During the drug round, the time-critical medications will be put at the top of the list of doses for administration to encourage timely administration. This drug is not time-critical. With all the information checked and entered, we can click on Continue. As with the quick list prescribing process, you are taken to a chart update screen to review what you are about to add to the chart. Once you have checked this and you are happy with it, select Update. On the chart, you will see the rivaroxaban is prescribed and a system rule has added an administration note to advise that it should be administered with or after food. Please note, you can access quick lists via the Prescribe button. To demonstrate this, click on Prescribe. We will do a search for paracetamol. With the partial drug name entered, select Search. Click Paracetamol under the single ingredient list. On the right, you will see all of the quick list items for paracetamol. For common medications, you may see a list of very similar looking prescriptions here. You can choose to either select one of the quick list items or select to drug form below and prescribe it longhand. Be careful to select the correct quick list. In this case, we'll select the quick list item, paracetamol 500 mg tablet, 1 gram oral 4 times a day. Check the start date and dose time. If you realise you needed to select an alternative quick list, you can always click to go back. We are happy to accept the quick list selected and its defaults, so click on Continue. You are returned to the chart update screen, where you must check the details before you update the chart. We are happy that all the information is correct, so we can update. The final method for prescribing is via protocols. In the chart view, select Protocol. Protocols can be used for single medications or to allow you to prescribe groups of medications together. On the left is a list of different prescribing protocols. We will look at insulin as an example. All insulin prescribing must be done via protocols, for safety reasons, to ensure the correct products are being selected. Select the protocol folder Insulin's Long-Acting. Then select the Lantus folder. Select the protocol Lantus Glargine Insulin once a day, night. You will see on the right hand side different options for Lantus disposable pen, cartridge or vial. There are also optional PRN, glucagon and glucose infusions. We will select the Lantus Insulin Glargine 100 units per milliliter disposable pen. Please note that the dose is set at 0, as the prescriber will need to specify the patient's dose. Next, select the optional PRN glucagon and glucose infusions. We can now click Add. You are taken to the schedule screen to check and confirm the starting date and time. In this example, we are happy to accept the default, so can click on Continue. You are taken to the chart update screen. Please note here that there is an error message against the Lantus because the dose is 0. Select the medication name. Now you can specify the required dose by selecting the field. We will enter 10 units. Note that the prescription is defaulted to be set to time critical, since insulin is considered a critical medication. Once the dose has been entered, click on Continue. You are returned to the chart update screen so you can make your final checks. Please note the small blue TC to indicate this is time critical. When you are sure all the items are listed correctly, you can click on Update. We can now see the insulin has been added to the chart and that the PRN number has increased to 3 with the glucose and the glucagon. If we need to edit insulin doses at any point once the insulin is on the chart, you can simply click on the name of the insulin to amend. You are now being introduced to some basic prescribing methods in the system.